Hello everyone, it's just Dr. Megs here again. I said I wouldn't do any more late night vlogs and yet here I am again after work, late at night, doing a vlog. But I've got better lighting tonight, so hopefully I look a little bit less tired than I did last time. Tonight I wanted to smash out a very quick video for you about a condition that everyone keeps asking me to vlog about, and that is attention deficit hyperactivity disorder, or ADHD. I see loads of kids through my clinic all the time who have difficulties with attention and concentration, and not all of them have ADHD. Problems with attention and concentration for children can result in a number of difficulties, including learning problems, sometimes behavioural issues like aggression or oppositional and defiant behaviour, social difficulties, sometimes poor self-esteem or low mood, and so on. So I guess given that there are so many opinions and misconceptions about this condition out in the community, the aim of this vlog tonight was to go through with you what ADHD is and how it is diagnosed. Attention deficit hyperactivity disorder is a condition of development that results in kids having poor attention and concentration and a limited ability to control their impulses. It's not an illness. ADHD affects children's executive functions, and these are the skills that everybody has that enables them to function in their lives in an orderly and an efficient manner. And they include things like planning and organisation, attention and concentration, obviously, inhibition of impulses or impulse control, inhibition of inappropriate speech or movement, and also things like working memory and the ability to start a task and complete it. So I guess having ADHD for a child means so much more than that child just being hyper or being hyperactive. Boys are affected more commonly than girls, and in Australia we say it affects about 3 to 5% of children. I guess what I'd like you to take home from this vlog tonight is that children that have a diagnosis of ADHD with appropriate therapy and intervention can and do lead completely normal lives. Now, there are a couple of very common symptoms of ADHD, 3 in fact, and these most common symptoms are inattention, motor overactivity, and impulsivity. They're pretty self-explanatory. So inattention, can't concentrate, can't see a task through to the end. Motor overactivity, they're fidgety, they can't sit still. And impulsivity, they do silly things because they just don't think before they act or speak. These difficulties can impact on a child's ability to learn and their ability to form meaningful social relationships and have meaningful and non-conflict-ridden interactions with their peers. It can make it very difficult for the child to follow instructions because they're actually not remembering what they've been told, and also makes it hard for them to regulate their emotions. So it can make them look like they're aggressive or oppositional when actually they're not. Skills in executive functioning, as we've been talking about, are a product of age, which means that we know that as the natural history is that they get better with age. As an example, a group of 2 to 3 year olds, we wouldn't realistically expect them to be able to safely cross a road on their own. So to be able to stop and go, hey, there might be busy trucks or cars passing on this road. I'm going to stop and look and listen and wait until it's safe before I cross the road. Of course not. A 2 or a 3 year old is just going to dash across a road. So I guess this is an extreme example, but it demonstrates why we can't diagnose ADHD in very young children, because inattention and hyperactivity is actually completely developmentally normal in young children. All right. In fact, ADHD is not usually diagnosed until a child reaches school age, so at least 5 or 6 years of age. So we have said that those skills in executive functionings improve with age. In a 2 or 3 year old, we would expect them to be pretty much non-existent. But by the time a kid reaches 5 or 6 and they start school, we would expect that a child of that age to be able to sit for a short period of time to attend to a task to completion. When those skills fail to develop and they actually result in significant impairment in that child's ability to function at home and at school, then and only then do we actually consider whether a primary attention deficit disorder is actually a possible diagnosis. So, talking about diagnosis, how do we diagnose? Usually it starts with a suspicion or a query from a teacher or maybe even yourself about your own child. You would present to your GP, who would take a history from you and maybe refer you through to a paediatrician like myself, or a developmental paediatrician like myself, where we would take even more history. We would go through a really detailed history about the child's medical conditions and their birth, etc. And we would also take a really detailed history from the child's teacher. And that may be in the form of a letter or a phone conversation, or it may actually be in the form of a standardized questionnaire. To get a diagnosis of ADHD, you actually have to satisfy a certain number of criteria, diagnostic criteria. The child has to display a certain number of symptoms that are associated with that condition. Those symptoms have to be present in a certain level of severity and cause a level of impairment that is actually evident across multiple contexts. So the impairment has to be visible at home and at school, or in another context where the child isn't at home. This is because if the child is inattentive, hyperactive, and crazy in one context, but completely well controlled in another, then we know that it's something to do with the environment rather than something inherent in the child. I hope that makes sense. There are also different types of ADHD that you sort of need to take into consideration, which means that two children with ADHD may not look the same. So there's an inattentive type of ADHD where kids are daydreamy, and if you look at them in a classroom, they're the ones gazing out the window, not getting their work done. These kids are typically not a behavioural problem, and so they often fly under the radar. There's the hyperactive impulsive type ADHD, and these kids are the ones who can't keep in their seat. They're fidgety, they move around, they call out, they interrupt. And when you look at them in social situations, they're often very up in your face, and other kids get quite intimidated by them. The third type of ADHD is the combined type, where kids have features, both these sorts of features. Now, if we talk about treatment and management, that would go on for another whole blog, so we're not going to do that tonight. I hope that tonight's blog has been useful to you. I am going to head for the showers and chill out in front of the telly for a little while. So hopefully this has been helpful, and if it has, please help me with a like and or a share, and I'll see you next time, and until then, keep well.